Hello friends, welcome to Friend of Health. So today in this very exclusive, very special episode of The Conversation, I have a very special guest with me, Dr. Harshit Garg. And he is the person who cracked the 2019 AIAPGET with All India Rank 1 and UPSC 2020 Medical Officer exam with the All India Rank 1. And welcome Dr. Harshit.
Thank you.
There is a poem by Henry Wordsworth Longfellow. The heights by great men reached and kept were not attained by sudden flight, but they, while their companions slept, were toiling upwards in the night. So I can see one person like that who has achieved great heights in the competitive exam field of homeopathy, and that is none other than Dr. Harshit Garg. So today we'll have a lot of learning from him, his experience in the field of competitive exam preparation in homeopathy, especially the AIAPGET and UPSC exams. So Dr. Harshit, before going to the learning session, from this interview part, I would like to know and let my viewers know about you. Can you please tell about yourself?
As you have told, my name is Dr. Harshit Garg. I came from Agra. My hometown is Agra. And I have done my UG from Pandit Jawaharlal Nehru State Homeopathic Medical College and Hospital, Kanpur. And after internship, in the same year I got selected in 2019 in MD, National Institute of Homeopathy, in the subject of Homeopathic Materia Medica. My grandfather, coming to the family, my grandfather was a homeopathic practitioner, also the ex-principal of Agra College. And my fathers and all in the family, from both the side, from the maternal and paternal side, they are engaged in homeopathic business. Okay. We are having the homeopathic shop. Okay. And my brother and some other persons are also practicing homeopathy and right now studying. Okay. So I came from a family where from childhood we are raised in the environment of it.
Okay. So you said soon after internship you got selected.
Yeah.
But there is a story actually. 2018, while you are doing your internship, just when you ended your internship, you cracked 2018 AIAPGET with All India Rank 6. And that was a best, kind of achievement by any intern, I feel. Till now, nobody has done that. And one more thing, many are curious to know, in the 2016 rank list, if you see, there is one person in the 6th rank, and he is not seen in the, he is also seen in the 2019 rank 1. So many will be curious to know why he did not join. So can you tell about that story also?
Actually, I started my internship in the month of around March.
Okay.
Or April, something like that. And I wanted to continue the preparation. I want to study for the MD. So I think the best part of study is in the internship, especially for the preparation or competitive point of view, because the competitive point of view studies are different from the theoretical for the university examinations. So what I did after completing my after completing my UG exam final year, I went to Kolkata and I purchased all the books for competition from College Street.
Okay.
That is one of the Asia's largest market of books. Okay. So I went there. Since in Kanpur the books that were not thoroughly available and there was no craze of MD. Okay. In UG at that time over there in UP, because there were no government seats and all, and the seats were very limited in NIH. So I went to Kolkata, I purchased the books, and as I have told in other video also, there was a quiz conducted in UP. So in there Alan's keynote was frequently asked. So I was same time preparing for that, and I purchased the books, studied it over there, and the exam I hope so was on the 24th June 2018, and I wrote it for that. In the 2 or 3 months, I wrote the 3 books that I always used to say, The Turning Point, Success and Kaizen. I read those books and I appeared for the paper and I got 6th rank. But at that time, I've only done my internship for 4 or 5 months. So I was not eligible for that. That's why I again appeared for the exam to get a seat in MD.
Okay. So there is one doubt for me. These 4 or 5 months and these 3 books, how extensive was it? How many hours? Because you were having a rank of AIR 6, All India rank 6, and that 4 or 5 months, it should be so extensive, I feel. Otherwise, you should be a topper in your BHMS. Whether you were topper in every year?
I got first position in all the 4 years.
Yes.
But since I think only at that time when the paper used to come of All India PG entrance, it was a very basic questions were there.
Okay.
and that are very nicely covered. It is not my effort, but it's the effort of those persons who have prepared these books. That they have prepared it so well that even a beginner, the person who hasn't read, you will be astonished that I haven't purchased Allen's Keynote in my entire 4 years of my UG. I purchased it after internship. I gave that exam after borrowing it from one of my junior. So that was the situation over there regarding the PG preparation and about the going for the exams and all. So I did it after my 4 years. So I purchased from all these books and read it from these, and I think that was sufficient. If you read less books with precision, so that was good.
And revisions?
I don't remember how much time I've got, but I have read line by line of that books, gone through that books as much as possible. So that 3 months of study was sufficient, I think, for this.
So soon after the 2018 exam, you started your preparation for 2019. How is it? Like, how was it? How was your plan in 2019?
Every year the paper is going to be tough. This I came to know because in 2018 I have seen the paper, 19 I have seen the paper. I came to know that allied portion especially, it is becoming tough every year. So I add a few more books. I joined some of the test series, some of the classes, prepared my own notes. And then I came up again with more better studies, with more, I added ROMs to my study material, and that is why I
so
again.
Can you tell like this, like first year subjects like anatomy, physiology, which all books you preferred or which all materials you kept for your preparation?
When I came for 2019, that was the chance when I entered. For anatomy, physiology, I kept ROMs only.
Okay.
And in Turning Point also some material is there, and apart from that some test series that I have joined, some questions that I have came to know during that preparation, that's only.
And regarding anatomy, you have mentioned in one of the video like that B.D. Chaurasia's back portion, that columns of that clinical anatomy and the B.D. Chaurasia books, that also you have preferred.
Yeah, actually this I have come to know from my teacher, that he used to say whether you read pharmacy 5 questions are going to come around, right, of anatomy. Whether you read anatomy or whether you read pharmacy 5 questions, no one is going to ask you how much questions you have got correct of anatomy or pharmacy. It is the total number that actually matters, right? So anatomy is a difficult subject to score. So why not to focus on other subjects that are easy? So if you have to read in anatomy, so I will prefer those portions that are easy and quick to grasp and to learn. That's why I said the blocks, the pink boxes of clinical anatomy that are given, because in that year one question, I don't know which question, I don't remember, came from that boxes. So that's why I said that we can go for easy things instead of difficult things.
And physiology ROMs alone.
Yeah.
So ROMs means you do only once reading and making adding it to your notes, or you will revise ROMs itself.
ROMs in itself is a book that is in a form of notes. So I don't think it's copying it again and again. Better you to go through several revisions again and again, line by line, and leaving the material that is when you are preparing now, you came to know which questions can be asked, which question is very tough and that portion will not be asked, that you can use your common sense and do it accordingly.
And patho, FMT, all this?
The same procedure I carried out for all the light subject. And one more thing to mention over here, I have done coaching from a private teacher at the time of my UG in Lucknow. His name is Dr. Noor Sir, Dr. Noor Hassan Sir. He used to take classes of Ayush students in Lucknow, offline classes at that time. And he used to teach subject with a great detail and from a clinical aspect point of view, not for preparation point of view. And many Ayush students of BUMS, BHMS and from Bihar, even from Karnataka, Rajiv Gandhi University, there was a student studying over there. That I think was the best part, because that classes cleared the things from the basics.
But this you are telling not for the competitive exams, for your UG exams.
Also for the UG as well as for the competitive exam, as well as for the PG, as well as for the practice. His teachings are, if your basics are clear, it will be easy for you to grasp the things, and that is what he did. And that's why I think that it is only his teachings that have led to such an easy success, effortless success, that I can say.
So your basic and foundation is clear, concepts are clear because of
regarding allied subject.
So he is not basically a homeopath.
No, he is an allopath.
So he takes classes nowadays.
Yeah, online. After COVID.
So that is one thing. And the other subjects, which books you have to, I mean, other than ROMs, any books you will like suggest for the allied subjects?
See, at that time when I have given the paper, ROMs was a sufficient book. And since what I am telling over here, please, I will suggest the viewers, don't take my words as oracles. Everyone is different. Everyone has an own identity. Everyone level is different. Everyone's study, clinical experience, knowledge, teaching, college is different. So use these words as a suggestion. You can modify it as per your capability, as per your preparation. It is not like that what I have did, you have to do the same. Just see your own. I have done it with ROMs only. You may need other book. Some people ask me whether to study Mudit Khanna or not. But from my point of view, what I think and I have felt is that instead of going for such high level preparation books that are used after MBBS preparation in MD preparation after MBBS, better to focus and study hard homeopathic subject instead of going to that subject. But I am seeing that in recent years the level of allied is also increasing. So if you are want to use it, so you may use, but first complete your basic and there is no end to preparation. So first complete your basics, then you can go to other books like Mudit Khanna, Sakshi Arora or some advanced books.
Yes, yes. Let me add one more point to this. Recently, like 15th of October 2022, the AIAPGET exam which is conducted is having a lot of deep level questions. Like a deeper understanding of the homeopathic subjects, a deeper understanding of some concepts of allied subjects are needed. So that also we can add to this. And this Dr. Harshit Garg's experience is always a guideline for us. And it's not the ultimate, as he said. Like it is a great learning for us, how to prepare, how to plan, how to follow some disciplines in the preparation level. That's all. Okay. So, Doctor, regarding your UPSC preparation, can you add some points on that? Like you are in your PG when you are attending the UPSC exam. 2019 November you have joined your PG, and by end of 2020 December UPSC exam is coming. So how you manage the preparation of that?
UPSC in preparation is exactly the same as MD preparation for MD.
Yes.
And in UPSC there are two parts. One part is the MCQ, another part is the interview. If the person who are called for interview are actually those person who have scored high in MCQ, and the persons who are selected for this post are actually those people who have scored who are in the top rank.
Yes.
So the thing is, net result is that it is not your interview that matters a lot, but it is your MCQ, that theory paper that matters. And in MCQ, the difference, first of all, I am saying that the preparation is almost same, that of MD preparation, that is going through these same books, going through these same test series and all. The difference is that in UPSC, the questions are not that fact and figures, not more than fact and figures, like we are having in MD. Because in MD, they are judging you for the skills of theoretical knowledge. They are trying to judge how much the student is academic oriented. But in UPSC, they are judging about your clinical skill, because it's the post is actually, it's a post of gazetted officer. So it's not only about seeing patient, it's not only about the research, it is also have some administrative responsibilities also. So they are judging you on the all round basis. So the questions will be more practical oriented. For that, apart from that, these books for MD, some questions come like of, say, from Materia Medica Pura. Some questions came from any rare source book.
Yes.
It's like that. But the other questions will be of an average level. For that, you don't need a preparation just 15 days before, or you don't need a very serious preparation of going through the books day and night just few days before. It is your overall experience, your clinical experience, your PG, UG, internship, everything that is judged in the UPSC written paper.
Yes. Like not only from the books, a lot of indirect learning you should have. That's what you want to do.
Yeah, and it is not that a last time study will work for UPSC exactly. As much it works for MD.
Exactly, yes.
And the one who has cleared MD for the government seat, I think it will not be a very difficult or a new strange thing to crack UPSC. Yes. It is that preparation only that works.
But the thing is, for PG entrance exam, we have 120 question, 120 minutes. But UPSC, that much time is not there for each question.
I think it is 150 questions.
Yeah, 150 question and 2 hours.
2 hours.
That is little tougher actually. It will become little tight.
Yeah, and the marking, negative marking is also 1/3, not 1/4.
That makes UPSC little tighter and tougher.
Yeah, that is there, and the seats are also less in UPSC. And as far as I remember, I have attempted 130 questions out of 150. And I have got 288 marks out of 400. So what I was calculating and expecting is, in interview it is 3:1 ratio is there. So 300 written and 100 is the your interview or the viva. So I have got 288 marks. So maybe I have got my questions correct around 100 or 105 out of 130, and rest all negative marking. And maybe around marks around 70 in interview, because UPSC doesn't get the separate marks of an interview, and it's all combined marks. So this is what I am expecting, that out of 150 I have attempted 130 and got correct around 110, what I am expecting.
So my one question is, from 2019 October, the PG life in NIH, we know it's an exhausting job, like a lot of patients you see a day, and your thesis work, your patients, your department activities. Along with that, how you managed, or is it the base you have which reflected on your result of 2020 exam?
You have asked right now, but I would have thought to answer it later, because I don't want to demotivate the student. It can be motivation as well as demotivation. Actually, I was not intended for the preparation of UPSC. I was not ready for the preparation. The reason being, when I have been selected in MD and came at NIH, the place which attract a huge number of patients and which is famous for its patient care in all over the world, I want to use my potential, harness it in the case of seeing patient. So I don't want to again go through the books of MCQ preparation, because everything has a different scope. The MCQ preparation will not help you as much in your patient care as much reading the materia medica and the philosophy. So I was not ready for it. So when the advertisement appeared and the exam was there, I was not at all serious, and in fact I was in a mood not to fill the paper, not to fill the write the paper. But one of my friend told that the center will be in Calcutta, why don't you fill it? So okay, I said just fill it. In the last days I just filled that form, and at that time the UPSC, there were 3 sections in that. One was a medical officer in the government of Delhi, one was in the research officer for the Ministry of Ayush, and other was the medical officer CGHS. All 3 were conducted and were through the same test. One written test was there. So what I did, since I was pretty sure that I will not be selected in UPSC, because since I am not preparing it for the things that you are not preparing it, you cannot expect a good result, right? So, and many other persons were preparing for this UPSC very seriously. And I have heard about it that cracking the paper of UPSC medical officer is quite tough, and the seats are also less. So I didn't prepare it for this. I just filled the paper. And it was 36 seats for CGHS medical officer plus research officer, and 7 seats for the post of medical officer for the government of Delhi. So there was 2 forms, but the paper will be 1. So I just filled 1 form, and I didn't fill another form, because I was sure that I will not be selected in 36. What is the chance of being selected in 7? So I didn't fill that form. So you can judge my seriousness for the exam of UPSC through this only. Okay, then the days went, people were preparing for this written exam, but I was sure that I don't have to do this, and I will not go in the job. The day of the exam come, we were all enjoying, my friends and all. Then I thought that if I'm writing, why don't I write the best? So what people were doing, that we will attempt 80 questions and 90 questions. But I thought that attempting out of 150, 80 questions means nothing. I will not be selected at all. So why don't give it a chance and do the maximum question? This policy I have adapted in AIAPGET also, that if your preparation is fine, then attempt the highest number of questions. In 2018, when I have got 6th rank, I have attempted 100 out of 100 question, and AIAPGET 2019 also attempted 100 after 100 question, and I have tested it also, that by attempting maximum questions you get more marks. So same policy I applied over here, since there was 1/3 negative marking. So I was scary at that time. I attempted 130 questions. So then after coming from the exam hall, I found it that yeah, maximum persons have attempted around 130, but I was sure that my questions will be wrong and I will be out of the list. Then the result came and my name was there in this rank list that I have been called for interview, and out of four seats, 1 seat, 4 persons candidates were called. So this was a chance. When I have got a chance, then I started for preparation for interview, and in that way.
So regarding your interview preparation, can you tell more about that? Whether you joined any coaching program or any grooming program for the interview?
Not as such. I used to watch videos of on YouTube of IAS officer, civil servant, like of Drashti IAS or of some academies. I don't remember the name, but that civil mock interviews were conducted and the videos are available. I used to watch. The thing that I came to learn is about when you watch such videos, obviously your questions will be different from that the asked in civil services. But few things are common in interview: your gesture, your posture, what one wants to hear, how to answer the questions of interviewer if you don't know what you have to say, like that. So there are some points that in interview what things can be asked. First of all, they can ask about your introduction. There were 2 panels at that time. So they were asking you how to introduce yourself, and if you are UG, since in UPSC UG can also apply, as you know. It is not, PG is not the essential criteria for selecting as a medical officer. So they may ask about internship assignment. In assignment we have to do in internship. So in interview you can carry your certificates, you can carry your thesis, you can carry your research papers inside the interview hall.
Yes.
And you have to hand over to the interviewer.
Even the articles you have written.
Yeah, the articles, works that have been published. So they can ask from internship assignment.
Yes.
About your topic, what you have done. And if you are a PG candidate, they can ask you from your synopsis, and if you have completed your dissertation, then from dissertation. They will ask.
Yes.
This is the favorite area of the interviewer to interrogate the student, the candidate. So I have read it, my assignment and my synopsis, because at that time my dissertation was not completed. So I've read it from where they can. Then since you can ask you about your subject in which you are doing MD. Though they have not asked much about that, but they may ask. Then regarding the current affairs they may ask. And for that I will like to suggest a book named by Arihant, that is told by one of my relative, of current affairs. That book is having a sections, like a section on health, current affairs on health, current affairs on environment, current affairs on political, regional, like that. And it is a good book, because a person like me, I am in NIH, I am not used to read newspaper daily, frequently. I don't got the opportunity. But after reading that book, a little one, haven't got much opportunity to read it completely, you get a basic idea about the current affairs. Then they can ask you about your city, from where you came, about the name of magistrate, about the name of your chief minister of your state, about your IPS officer, about your constituency and all. They may ask. This is my suggestion, what I think. What they haven't asked me, I will tell you later. But what I think, the areas, the zones from where the questions can be there, that I am telling. Then you can ask about the website of Ayush. Ayush website, how it is, how many sections it have, how it is maintained. So one should go through the Ayush website and the site of CCRH and other related websites. Then they can ask you for the post for what you are applying, what is the nature of the work, what do you expect, research officer, CGHS. For example, I am applying at CGHS. So what is CGHS, when it was established, what is the purpose of this scheme. They can ask you about the emergency care, how will you manage the emergency care. This is a favorite question, because in interview panel there is an IAS officer and the 2 subject expert. So this can be the question: if the lady comes in labor, if the person comes bleeding, what will you do, how will you tackle the cases. And they can ask you some good cases of your clinical practice. What all good cases have you seen during your PG, during your internship, or during your private practice. And since in UPSC form, when we fill the form, there is one column of hobbies. So they can ask you about the hobbies that you have mentioned, or you have just mentioned it, or you really do it and practice it and enjoy it and you know about it. They can ask you about the community programs that are running, since CGHS is also a program, the scheme of the government, by the central government for the employees. So they can ask you more about the programs running by the Indian government for the people's welfare and health. So they can interrogate on that SPM, that sort of point.
Okay.
That's
so one point we missed regarding the AIAPGT preparation, I feel, is that mock test. When you said about the mock interviews, I remembered about that. So we'll just mention about the importance of the mock test things, series and all. Then we'll go back to the interview experience proper. Now we have given a proper outline, like how to expect questions, how to anticipate some areas of questioning and all. So from that directly, the real life experience of interview, UPSC interviewers and your colleagues, you can mention. Just before that, just mention regarding the importance and the test series which you have joined and how it helped you.
After reading through the books, whether it be your competitive books or whether it is your notes, when you have to appear for the exam, it is very good to have an experience. That is why the value of experience always lies. And it is in this fact, because after giving your mock, we understand ki where are our fault. We have read it very nicely, but what subject we have to prepare, what is the actual weakness we are having, and what are the problems that we actually face while writing. And this is only came to know through the mock test. For example, we may be very good at studies, but when we go to attempt the questions, we attempted all the questions and we are having a huge negatives. So we came to know that what should be our limitations, how much questions we should attempt, like that. There is a very frequent questions that is asked by many students to me, those who are aspirant of AIAPGET, that whether we should study theory or we should solve MCQ. So I always used to say that you have to make a balance of it. Not so entirely solving the MCQ, not entirely reading the theory will help. It has to be a balance, and this balance you have to see. What I suggest is, from my point of view, you read it theory and at last you solve one MCQ paper. Within in a week you solve at least 2 or 3 MCQ paper, so that you get a practice of it. You see whether I am doing good at, after attempting many questions, I am doing good at attempting few questions, areas which I am lacking in. But it has to go hand in hand. It can be 60-40, 60 theory, 40 MCQ, or 70-30. But it can't be 20-80 as it used to be many years previously. People just go on solving MCQ and not reading the theory. That will also not work.